which I've been doing all day. I'm so sorry about my throat being rather raw at the moment. But also myself and Antonius will present this. And what I suggest is that we move on. I hope you can hear me okay. If you don't, just put something in the chat there and I'll try to speak louder, but I am struggling just a little bit at the moment. So now we're going to talk about the cluster. If I can go to the next slide, please. Okay, so what I'm trying to say here in common, and I've highlighted some of the key issues in here. What we're trying to do with this cluster is that a number of projects are coming together, and we're all in the same kind of space. And what we're trying to do is get a collaboration going. Why? Because it's not about giving a presentation like this, which would be fantastic. It's all about sharing knowledge and understanding. And while we're doing that, we can overcome problems collectively together. So it's very much so a user-centric, which is part of today's session, but we're sharing knowledge, we're sharing understanding, we're working as an entity. And as we move forward, if I have a problem in my project, I can talk to my colleagues. Or if I have a common interest could be like the data sets, which came out from Barbara's conversation this morning, what she talked about, where they're going forward with the platform, and interoperability was mentioned there. So all of these are part of some of the items that we're addressing. We're trying to grow this cluster, make it go forward. We're encouraging others to come on board as well, and we're sharing knowledge and understanding so that we overcome common problems together as a unit, and that makes our work more efficient and more effective. So the final outcomes of our results, I think, will be more stronger, and very much so, as I said earlier on, it's a highly user-centric approach that we're applying for all our work. And I think the motto down there is very clear: we don't work in silo, and that's the way we're going. So I think we're going to try to use this cluster concept to try to apply it to other areas, and not just the area of post-cancer treatment recovery. I think others will follow our suit as well. And as you can see, all the projects today and of yesterday presented their work, and you can see they are quite diverse, but yet they're all in the same common area. And some projects are further than others, but we're kind of working as a team to go forward. I think that's tremendous at this stage. I'm very pleased with everybody supporting this. So if we go to the next slide, please. So as you saw from all the presentations from yesterday and today, these are the patients that were the types of patients that we're dealing with. Age and gender and so forth are irrelevant. So we're working right across all this specific area from all these specific projects, and more will come on board. I'm quite sure in that, and we will be adding to all this. But the same principle remains: we work as a unit, we share common problems, and we try to solve them together collectively as a unit. We go to the next slide, please. As you saw, many of the issues were addressed both today and also yesterday. So we talked about fatigue, we talked about depression, we talked about the quality of life, which is mentioned many, many times. We talked about cognitive impairment. So these are all covered collectively in our discussions, and we support each other when addressing all these areas here. So the connectivity area is fine. We saw yesterday all these projects. I'm very grateful for everybody who participated, from Faith, Menhar, Life Champ, Connor Relief, Quality Top, and Persist. So each of them, you saw yesterday what we were doing, and I think there's fine work going on, but we do meet and we do discuss problems. We try to solve them collectively as a unit. Today we saw 3 more projects. Go to the next slide, please. So today we saw Pedro and Maria gave a very clear explanation how they're using the data, large volume, and how it seems to be working quite well. And the patients there, I think about 17,000 are going to be involved in that project. John, who was very kind this afternoon, explained very much so what they're doing under very difficult sessions. And in Life Champ, we saw very much so what Ionis and Lazarus were doing. So all part of the cluster, all working as an to kind of go forward, working as a team. So we go to the next slide, please. So just give you some highlights of what we did. We initiated the cluster in Q4 2002. We've had many constructive meetings where the vision and understanding was explained in detail, and we worked as a unit. We explained to the European Commission, made them aware of the cluster and activities. We stayed as a cluster working in-house as opposed to our first time today opening up and meeting the wider audience. So the Media Minds 1 was held. We had there a number of patients who were explaining their condition. We focused very much on mental health, and on that basis, we try to obtain their knowledge and understanding. So when we're building our solutions, the knowledge acquired was brought into the equation. So that was very good. More projects joined us. Live Champ Antonis is will continue with his presentation. Quality Top and Clarify joined us then in January and March 21. We then started to open up to the outside world, where we have press releases, multimedia, social media to generate relations. Then we had two in September. We had we looked at the other area. When these projects are going to go forward, they'll come to an end. So we wanted to kind of get a better understanding of how the outside world sees us and how we can engage with them. So we had we call it a business acumen kind of approach, where we discuss business models. We discuss very much so how to engage with the clinical trials, but it was all on from a business perspective, and that was held in September. Then we open up looking at more issues. So we brought more technical aspects to the group, and we looked at clinical trial preparations, specifically when COVID was in a rampant state in the States, how best we handled it. We talked about ethics. We talked about many issues that were all commonly relevant to all the projects. So the knowledge acquired was shared right across each project, and we continue to support one another. So as I said earlier on, common problems, common solutions is probably the method that we'll probably use going forward in next year. Then later on, our ESA Victoria was very prevalent today in the discussions with Aspect, and also Rebecca, and as you know, Victoria leads the Persist project, who we heard yesterday, and of course Aspect joined as well in September, October. Plans were put in place for 2022, which we're now executing. The first one being today and yesterday. And then Rebecca joined us in January 2022. So you heard Lazarus and I a moment ago, and we've delivered our roadmap and program for 2022, which is an operation which you're going to explain. So in short, we're saying that the principle we're working off is the whole is better than the sum of the parts. And that's a very, very important comment, because I think if we work as a unit, we're going to get better results. So I think as a unit, we will have stronger outcomes. And that's the principle we're working from as we move forward. So then we go to the next slide. Now, this is where I'm going to pass the floor over to Antonius, who you know has been quite active and has been on Live Champs, and we will walk through the plans that we're doing. Antonius, can I put the floor to you now?
Yes, thank you, Tom. So as Tom already explained, there has been a long time that this cluster is active, and we have currently managed to expand to already 9 projects relating to cancer and quality of life. So we are quite ambitious that this cluster will continue its activities in different aspects. Here you can see some plans for the year to come, since most of the projects that are part of the cluster are already running into their 3rd year of implementation. For sure, technologies are getting more mature, and pilots are ongoing, and hopefully also research results and the outcome evaluation of these projects are going to be available. So I think that this will give us the chance to further disseminate our results and also have our presence also in public. So starting from this event today, this 2-day event, it's the first public event that all 9 partners of this cluster participated and presented their project. Our aim was to showcase current technologies, receive feedback from patients. Also, you have noticed that there were also sessions that we tried to include patients' opinion, patients' feedback, and this is what Tom also stressed in his speech previously, that this is a user-centric, a patient-centric cluster. We try to digest feedback from patients and try to implement their recommendations into our technology solutions. So another endeavor that we aim to to follow up during 2022 is to find a way of compiling the different datasets that are being collected under the different projects and find a way of common exploitation and sharing of these datasets. There has been a discussion previously, if I recall correctly, by the European Cancer Mission representative. She explained the importance of having a digital space for cancer. She also mentioned the collaboration of this space with the EU health data space. So our aim is to find our way into contributing also into that direction. So there will be an active channel of communication among partners and see how we could fit as a cluster into shaping this work as well. Today, unfortunately, due to COVID, we went online. We tried to have, let's say, an interactive discussion and exchange of feedback with patients, with caregivers, even with clinicians. We all know that this is difficult to have an interactive, let's say, workshop online. So our plans are that we expand this workshop and we really hold hands-on sessions, inviting patient representatives, patient associations who are active within the projects of the cluster, even inviting organizations, but European organizations like European Cancer Patient Coalition, and trying to organize this, let's say, live event, face-to-face event, probably within late spring or beginning of this summer. If we may go to the next slide, please, Zoraida. Okay, so there was already some workshop where we tried to figure out what the different business models of the different projects, so how we exploit the results of research that has taken place at the moment. Of course, this wasn't mature enough by the time that we hold this workshop, but the idea is that we follow up the discussions that took place back in 2021, and we have another a workshop by the end of 2022, where we expect that most of the projects are heading at the end of their implementation, and probably technology are more mature, evaluations have been finalized, so we will be in a position that we can better identify how to better exploit our results. Then, of course, as we are all our research projects, our aim is to create, to at least suggest some scientific sessions under the umbrella of the cluster into conferences. We want to increase the publicity of our cluster, of our projects. Of course, our aim also is to organize special issues in journals, so to help disseminate as better as possible the results of our research. Can we move to the next slide, please, Zoraida? Okay, so there are 4 more points that we have planned. The first one is about drafting a white paper on the cluster activities. And of course, this white paper can provide some hints for policy making regarding research in terms of cancer care and quality of life, and how technology can better support these aspects. Again, there have been several internal discussions within the cluster about how to better involve patients, how to provide incentives. There have been a lot of discussions even today and yesterday, and this is a matter that, as as the pilots are ongoing, there might be an issue that even due to COVID, we might be in a situation where there are dropouts, and we need to engage patients into the pilots and the clinical trials in order to allow for better and more accurate data collection in order to build our models. So this is something that we are going to have as a series of discussions We aim to have these frequent discussions within the cluster and try to figure out lessons learned and suggest better practices on that aspect. There was also a suggestion by our good colleague Yannis Avramidis from Escape Project, who is willing to lead this initiative. Our intention is to organize a series of podcasts with the participation of experts from within our consortium, but also from other affiliated entities in partners in the consortiums of different partners, with different thematics, including ethics, perspectives of patients on quality of life, even technological aspects, etc. And finally, the last point is to to schedule a roundtable session with the European Commission. I mean, as I said, we are targeting different aspects, even at the policy level. Our aim is to have better practices, suggestions for policy making, etc., with the European Commission, with the Cancer Mission Board, etc., and trying to understand how the cluster can be of use for this aspect as well. I don't know if there's, yeah, and that's all from my side. I don't know, Tom, if you want to close this presentation.